From the jungles of West Africa, the most feared virus on Earth. The dramatic story of two hospitals, one sacrificing everything to keep Ebola patients inside, and the other fighting to keep them out.
Guys, quickly, please! The reason why Ebola is so much worse than all the other diseases we know about is because it's that contagious. And it's that deadly. One little drop is all you really need.
This is Dr. Gillian Seaton, one of a handful of surgeons in Liberia. She lives in this small apartment with Divine, a 1-year-old boy, and the first successful neonatal resuscitation at Cooper Seventh-day Adventist Hospital. Gillian is now a second mom to Divine, the only family she has on this side of the world. After graduating from Loma Linda University School of Medicine, Gillian moved to West Africa for the next 10 years. She's a general surgeon at a hospital run by Adventist Health International.
All right, little one, you good.
When the Ebola outbreak hit, Gillian had the opportunity to evacuate, but decided to stay to help her community.
I was always drawn to the idea of being a MacGyver doctor. You're kind of the last line between people and nothing. If you were used to the healthcare system in Europe or Canada or the US, think of what it was 50, 70 years ago. Not in terms of knowledge, because the knowledge base here is good, but in terms of what you can actually physically do for a patient. We don't have x-ray. There's one CT scanner in the whole country, and that's 11 hours by a terrible road inland. Your laboratory tests are basic.
Now outside of the hospital OR, Gillian scours a medical textbook. The things she sees fall well outside what is familiar in Western medicine. Although the book was published in 1960, it's a valuable resource.
It's actually got relevant information for the resources that we have on hand. It's a different set of skills, and you really get pushed beyond your limits. And that's kind of what I wanted in life. I wanted to be challenged at a different level. I wanted to make my efforts count towards something. To me, it doesn't have to be big or small, it just needs to be something.
When Dr. Seaton first arrived in Liberia, there were only 100 doctors to care for a population of 3.5 million. Today, because of the Ebola outbreak, there are far less.
All the things I thought I would face in Africa, Ebola was not on my list.
Ebola swept through the region and killed up to 90% of those infected. Originating from a colony of bats in the jungle, from Guinea to Sierra Leone and then to Liberia, the virus spread like wildfire, uncontained by West Africa's open borders. And because Ebola looks like so many other illnesses at first, by the time someone knew they had it, it was already too late.
I wasn't that worried because it's far away. It's difficult to travel, the roads aren't good, that sort of thing. I thought, for sure it's just gonna get contained out there.
But Ebola was on the move, as fast as people could travel. At first, Gillian heard rumors of a deadly disease from the jungle, making its way to the city.
They look like zombies. I mean, it's that kind of expression in their face.
You could see people carrying their loved ones in wheelbarrows, trying to reach them to the nearest medical center. And then doctors also turning their back. You see the pickup truck coming, covered with tarpaulin, and people tell you they're social bodies. 50 human beings.
The sick swarm to hospitals first.
One hospital after another reports a case after a case.
Once inside, Ebola spread throughout, killing patients and staff. Instead of treating Ebola, hospitals were helping to spread it. Overwhelmed by the virus, nearby hospitals had to shut down to contain the outbreak.
There's 3 more hospitals left in the city. We're next.
People started dying in their numbers.